Bill Shepard with SoonerPoll.com here again with you, standing in the rotunda of the state capitol here in Oklahoma City. We're joined by State Representative Dennis Johnson from Duncan. Thanks for joining us, Dennis.
Good to be here, Bill.
Appreciate you.
I was already here, you know that.
Well, you're paid to be here, I guess.
I better be here.
That's right. Let's talk about health care.
Certainly.
It's been a big issue here, not only at the national level, but even at the state level. There are requirements for the state in which to be able to fulfill different parts of Obamacare.
Right.
But let me read you what the public thinks about it, and I want to get your
Certainly.
opinion on it. We asked in November of likely voters, fighting to repeal health care reform law should be the top priority of the next governor and legislature, and we got almost 62% that agreed with that. What do you think that says about what we need to do with health care?
Well, I would say that our current governor that's coming in was proactive for that 62% you're talking about, because she has immediately enjoined our state with the other lawsuit that's currently in progress to try to repeal the health care plan that our current president was able to get through. Oklahomans are not in favor of something like this. Oklahomans have always been folks that want to do for themselves, take care of their own business. They don't like to be told what to do. And that's reflected in your poll, that 62%. What we need to do as far as a state is, number one, continue to work toward the repeal of the health care, and then number two, try to make our own health care plans more affordable, more inclusive, reduce the cost as best we can. And there's all kinds of ways to do that, and there's been several proposals this year that look kind of promising.
Of those ways that you talk about, are they all public policy ways, or is some of it also private policy ways as well?
Well, for example,
meaning the public, what you all do can't solve all those problems.
No, obviously no. The cost of keeping people alive costs more money. Mm-hmm. There's more equipment, there's more technology. Those things are very expensive. Mm-hmm. And so just because of those things, we're going to have a normal increase in the cost of health care. But for example, our government doesn't provide our auto insurance, they don't provide our life insurance, they don't provide any of our other insurances. They don't need to really be messing with our health insurance either. If we can open up the state lines, for example, and be able to shop anywhere for health insurance, the more competition right there will bring costs drastically down from where they are now, because there's a much bigger pool to draw from. And just things like that are free market type solutions, those things would really address these costs.
Do you think Oklahoma is better positioned to try to address those issues with healthcare than the federal government is? Right
now, we have, of course, a Republican governor, Senate, and House. We're in a position with the Republicans, as a rule, are going to be looking more for free market type solutions.
Right.
We're in a position in our state that few other states have, in that all these three branches of government are going to agree on a lot of these things, so there'll be less hindrances to us to try to change some of those state policies to allow folks to actually be able to see a reduction in their health care costs,
right,
or at least in the increase.
Right.
Of
Governor
those things.
Fallin won by about 60%. You all have 70% basically of the House seats.
Yes.
And we're talking about 62% agreed with making the repeal of the healthcare reform the top priority. Do you think that correlates at all?
Oh, absolutely.
Right.
I don't think anyone out here would dispute the fact that a lot of the results of our current election are because of national trends. Mm-hmm. And you can reflect that if you go back 5 to 10 years in our state, you're seeing a gradual return to traditional values and more of the things that Oklahomans have stood for since statehood.
What would be the price you think Republicans will pay if they don't aggressively go after these issues that they ran on? And obviously the mandate, it appears that they were given in November.
Absolutely. Anyone who says one thing and does another deserves to be called into account. Mm-hmm. And the Republicans have been put in this place by the taxpayers of Oklahoma for a reason. It's not because we're Republican. Right. It's because we identify with the things right now that are important to them. And those are the things we've been talking about. That's what our governor, what our state office holders, House and Senate, we've all been talking the same kinds of issues that the folks that were watching, that were going to the polls and were doing the voting, said that's what I want to see happen. And most could care less whether you got an R or a D behind your name, but they're seeing those issues and they're saying, that's the kind of thing I want to see done. And that was reflected in our elections.
Dennis, thanks for joining us. Again, Bill Shepard, SoonerPoll.com, Oklahoma's public opinion pollster.